Assalamu alaikum. This video related to grade 12 health sciences curriculum term 3 unit 9 clinical nutrition يعني التغذية السريرية. In this unit we'll speak about the three parts: therapeutic diet for diseases management يعني النظام الغذائي العلاجي وإدارة الأمراض, diet for diabetes, overweight, heart diseases, renal diseases and bone diseases, and eating disorders اضطرابات التغذية.
First of all, we should know what therapeutic diet means. It means النظام الغذائي العلاجي. Diet related to any food or a drink which we daily take it, and therapeutic related to the healing of diseases. So diet therapeutic, it means use diet to management and treatment all the diseases which we will speak about it. You should know that this diet therapeutic, it's a special kind of diet. Please ladies, try to concentrate on all the sentences which I highlighted with a yellow color. And it's important to know that a therapeutic diet, it's a diet plan that controls the intake of food or nutrients. It is part of the treatment and medical condition or diseases. Now we should know more about what is the common type of therapeutic diets. Common types يعني الأنواع الشائعة أو أشكال therapeutic diets. There is 5 different common types. 3 of them related to modifications and 2 related to feeding. Nutrient modifications, texture modifications, allergy modifications, and tube feeding and addition feeding. In general, you should know just small information about everyone. Nutrient modifications related to everything which you can add it or cancel it from your diet or from your food, like how to add calcium, how to cancel sugar, how to make it low salt, how to make it low fat. All of these modifications, التعديلات, we call it nutrient modification. Texture modification, there is 2 different types of texture modification: mechanical soft diet and puree diet. And texture related to how much it's soft, ملمس الطعام. Texture modification, mechanical soft diet and puree diet. Main difference between both, that mechanical soft diet, it's like a rice with milk. But when we speak about puree, it's something like cereal or potato puree. You can't find any solid pieces inside it. Both of these ways, we use it in different cases of different diseases or disorders with different peoples. To know more about food allergy and intolerance modification, what's different between both? The first one, food allergy, it's related to the immune system. If you have a problem in your immune system, it's some problem in the immune system, when you eat anything which you have allergy from it, your immune system will attack this food, will attack your body and attack this food. But food intolerance, it's a problem related to the digestive system. That means in your stomach, when you digest this food, a kind of foods, your digestive system will not accept it. So this is the main difference between both. Also, you should know more about tube feeding. 2 types of tube feeding. First one, you can see it in the top picture. It's a liquid tube feeding to replace meals that these kids or anyone that can't eat any food, and this tube will replace meals, will not take any meals, only depend on this tube to eat and drink. Other way to tube feeding, for also addition feeding. There is 2 types of addition feeding: supplements and nourishment. Supplements, we call it مكملات غذائية, and most of the time we take usually our meals in a usual way, but it's a liquid which we can take it after meal or with a meal to help support our body with the minerals and vitamins which we need it. But nourishment, we call it مغذيات. It's something like a food or a drink itself. We consumed it, يعني we use it and will not use other food. We depend on it to have our minerals and our vitamins.
Example to know more about therapeutic diet: if someone has hypertension, يعني ارتفاع ضغط الدم, they may have able to get their blood pressure back to a healthy level by changing their diet and follow therapeutic diet. They would then no longer be classified as having hypertension. This reduces their risk of other cardiovascular diseases. بقلل مخاطر إصابته بأي أمراض لها علاقة بالجهاز الدوراني مستقبلا.
One of the most important disease or disorder which we should speak about it and control it by therapeutic diet, it's overweight. Overweight, it means to have extra weight or to be obese sometimes. Obese, that means more than extra weight, يعني السمنة المفرطة. This will increase your risk to have diseases and disorders in your life. And the most important thing that you should know what to control or to avoid overweight, that you should reduce your number of calories which you consume it daily, and increase physical activities which you should do it daily. So, energy balance, if you want to know more about energy balance, it's like a small equation. Energy balance equal energy input minus energy output, and energy input, it's everything related to the food and the drink which we eat it daily. Energy output, it's all the burns calories which we can burn it inside our body daily. It's very easy, ladies, that if your energy input it's more than your energy output in the amount of calorie, if the energy input more than energy output, then you will have extra weight. But if your energy input less than energy output, you will lose your weight. So try to keep all the time, if you want to lose your weight, try to be your input less than your output. There is 3 ways which we call it energy expenditure inside our body. Energy expenditure, it means مصادر أو أشكال صرف الطاقة inside our body. There is 3 ways to expenditure our energy inside our body. Basal metabolic rate, BMR, physical activities, and thermal effect of food. Basal metabolic rates, it's how your body burn calories inside your body while you are in the rest, while you are sleeping, while you are doing nothing. So it's between 60 to 75% of total energy expenditure. We will lose it daily using burned calories in basal metabolic rate. Physical activity will burn only between 15 to 30% of energy expenditure inside our body daily. And thermal effect of food will burn only 5 to 10% of the food inside our body, and this total it's related to calories which we use it to digest food inside our digestive system. Again, ladies, to have a good weight all the time, you should decrease your calories amount and increase your physical exercise. Also, you should know that there is a lot of factors that affect on our weight, but we can't control it. Affecting our weight maybe will be overweight and obese or less than normal weight. These factors related to genetics sometimes, family history, medication and medical conditions, but we can't control that. Type second disease or disorder which we should know more about it and control therapeutic diet on it, it's diabetes. Please try to concentrate in this paper because it's like a small summary which will give you all general information about it. On diabetes case, we should limit sugar for the patient, make the food limiting sugar, so less sugar, limiting carbohydrates. Our body will convert carbohydrate to sugar, to glucose sugar, and will use it as a sugar. So carbohydrates inside our body, that means sugar inside our body. So if we want to limit sugar, that means we should limit carbohydrates also. Limit saturated fat, that's because we should avoid high calories and avoid heart and cardiovascular system problems. More fiber all the time, more fiber to be sure that this patient will feel full most of the time. will give this feeling. Fiber can give this feeling. Manage portion size. Portion size related to our plate size or food size, how much we eat daily. We should manage it all the time. What you should know about diabetes? You should know that there is 3 different types of diabetes: type 1, type 2, and gestational diabetes, which are related to the pregnant time. Type 1 diabetes related to that our body can't produce enough insulin. Type 2, that means our body can produce enough insulin but can't use it. And gestational diabetes is just in a small period, temporary period time for this kind of diabetes, which will finish when after delivery. How we can manage portion size for the people who have diabetes? Portion size يعني الحصة الغذائية. There is two ways: plate method and carbohydrates counting. Carbohydrates counting is very easy. You should count carbohydrates as recommended for diabetes with a WHO. But a plate method, you had a small way to use a plate method, and it's more easy to use it than carbohydrates counting. That all the time you should use a small plate. Half of this plate supposed to include vegetables, quarter of it supposed to include protein with no lane, and other quarter supposed to include carbohydrates and whole grain. You can take kind of a fruit, patient can take kind of a fruit, and a small healthy snack between this meal. Heart disease. Heart disease is as one of the diseases which you should know more about it to control therapeutic diet. In heart disease or any problem, any patient who have any heart disease, we should cut down saturated and trans fat, and you should know why. We should reduce salt. Also, you should know why. More whole grain. كمان you should know why. Most of the meals supposed to include fiber and more vegetables and fruit in the meal. Try to know why. More starchy food and use DASH diet. Why we should use DASH diet, or what is DASH diet أصلا؟ DASH diet, dietary approach to stop hypertension. يعني النظام الغذائي الممنهج لإيقاف ارتفاع ضغط الدم. DASH diet, it's diet or dietary approach to stop hypertension. WHO decided this kind of DASH, and people following the DASH diet who have hypertension can expect to see a reduction in their blood pressure in the short term. There's two version of DASH diet, standard diet and lower sodium content diet. You should not know more about it, just to know that there is two versions, and you should know why it's important to have a plan in DASH diet, to lower high blood pressure, to reduce the risk of heart diseases, and to prevent or control type 2 of diabetes, improve cholesterol, and reduce the chance of developing kidney stones. Renal disease. Renal disease, it's any disease which related to the renal, to the kidney, للكلى. Use DASH diet will be fine for the renal disease. Low protein all the time, and you should know why. I wrote the answer all the time using orange color, so you can know the answer clearly, ladies. You should increase sugar all the time, increase vegetable, low potassium and low phosphorus. Try to explain why for each point of these points. Bone diseases, how we can make therapeutic diet for the bone diseases. We should increase calcium because it's important for our bones. Increase vitamin D because vitamin D will help to absorb calcium inside our body. Cut down caffeine. Cut down, it means make the amount less, not to cut it forever. يعني لا نقطعها بس نقلل الكمية. Cut down caffeine and cut down fizzy drinks. Other disorder or disease which we have it to therapeutic diet, related to therapeutic diets, it's food allergy diet. And the main important thing which you should know it about that all the time we should avoid eating the food which make for the allergy or intolerance.
Diet for food allergy. All the people who have allergy from any kind of food, they must avoid eating that food and avoid cross-contamination between the normal food and the allergen food. Cross-contamination can occur when particles of the allergy-containing food land on another food that is normally considered safe for the people who has allergy. We call it like تلوث عبر الأغذية المسببة للحساسية. How we can avoid cross-contamination? By use different cooking utensils for preparing the meal. باستخدام الأواني منفصلة للناس اللي عندها حساسية. Don't store the allergy containing food with other foods and check all food labels for the allergen. Avoid cooking in the same tray. تجنب الطبخ في صواني واحدة. And use the separate preparation area. Clean the area carefully after finish preparing food for the people who has allergy. And in the restaurants, ask any one of the staff if this food included anything related to allergy. Summary for all the diseases and disorders which we can control it using therapeutic diet. In diabetes, we should less our sugar, less carbohydrates, less saturated fat, and eat more fibers. In heart diseases, less saturated and trans fat, less salt, more whole grain and more vegetables, more starchy fat. In renal diseases, we should use less protein, more sugar, more vegetables, less potassium and less phosphorus. In bone diseases, more calcium, more vitamin D, less caffeine and less fizzy drink. And in food allergy, we should avoid any food which can make allergy. Last part of this unit speaking about eating disorders, اضطرابات التغذية أو اضطرابات الطعام. And eating disorders is any problem between you and the food. Even this a problem that you eat high amount of food or less amount of food. So there is 4 different disorders which we can speak about it here. Anorexia nervosa, فقدان الشهية العصبي. Bulimia nervosa, شراهة الأكل العصبية. Body dysmorphic disorder, اضطرابات تشوه الجسم. و binge eating disorder, شراهة الطعام. In anorexia nervosa, all the time the people try to keep body weight as low as possible, so that most of the time they try to eat less than they need. They're not eating enough food and over-exercising to burn extra calories. What's the most anorexia nervosa symptom? Low BMI, and we spoke about BMI in term 1. Eating very little, lying about what and where and when they eat, and believe all the time that they have extra weight, they are fat or overweight. Taking slimming tablet, حبوب التخسيس, stop period in the ladies, tired and dizzy, hair losses and skin problems. Another problem, bulimia nervosa, شراهة الأكل العصبية, and we call it binge and purging. يعني الالتهام ومن ثم التطهير. That means they try to eat a lot, then try to lose this food using different ways. Why? Because they try to keep body weight as low as possible all the time. What they do, they consume large amount of food in a short time, then purge food using laxative for over-exercise or over-exercising باستخدام مسهلات أو تدريبات رياضية. What's the most important bulimia nervosa symptom? Feel tired, problems in teeth and dental problems, irregular period in a ladies, dry skin and hair, brittle fingernails, هشاشة الأظافر, heart and kidney problems, and bone problems. One more problem related to, or one more disorder related to eating, body dysmorphic disorders, اضطرابات تشوه الجسم. This problem happens most of the time because of anorexia nervosa, or starting all the time with anorexia nervosa. When the people feel that they are not fine with their weight, all the time they can't control this feeling, and they spend hours daily worries about how they look like in a mirror. Last disorder, which you should know more about it, it's binge eating disorders. To eat more, difference between binge and purging, bulimia nervosa and binge eating disorder, that in the bulimia nervosa, they try to eat, then try to purge this food using different ways, but in binge eating disorder, try to eat only without purging. So they eat large amount of food in short period of time, eating until uncomfortable full, eating when not hungry, eating insecretly, feeling guilty after a binge, شعور بالذنب, hiding how much they eat, and storing food, gaining weight, sure that they will gaining weight because they eat a lot and more than what they need. Helping someone with an eating disorders, you should know that most of the peoples who have eating disorders will not want to admit they have an illness and may not want to help, so you should do your best. You should give them many facts about the health effect of their eating disorders. All the time you should encourage them to get treatment, and you should follow these steps when you will speak with them. Pick a good time, don't speak in any time. Explain why you are concerned with them. Be prepared for resistance if they will be angry. And be patient and supportive. So this is everything which is related to therapeutic diet unit 9 in the grade 12 curriculum for term 3 health sciences. Practice in your workbook will support what you learned here. Thank you, ladies, and good luck.